It's the goal of every parent to see their children grow up healthy and happy. Disease prevention is an important part of maintaining your child's overall good health. 27.5 million children in the United States need regular medical attention, and 37% of U.S. children 17 and under have at least one health condition, according to the Centers for Disease Control and Prevention. So what can we do to help our children on the road to living healthy, long, and productive lives? Dr. Efrain Rodriguez, a family medicine physician with South Texas Health System Clinics, joins us now with some advice. Now, Doctor, welcome to the STHS family. We're glad to have you here today.
Thank you for having me.
And let's talk a little bit about children's health. Now, obviously, you see the entire family as a family medicine doctor, but specifically in the Valley, diabetes is such a huge issue across the board, but with children especially, it can be really damaging if you don't take care of it from an early age. Tell us a little bit about diabetes in children.
It takes time to detect diabetes. That's why it's important for the children to be seen at least once a year by the pediatrician or family physician. And during those visits, in a wellness visit, we usually check. We can check an hemoglobin A1C, and that gives us an average of the sugar level in the past 3 months. If we see that the child has some risk factors, such as family history of diabetes, or the kid has obesity, overweight, we may check those labs through blood work.
So it's important really that A1C is crucial, especially if you have a family history. Is there anything that they should be looking out for, signs, symptoms, warning signs that they should look for?
Some of these symptoms are similar to the ones that adults experience. They may have excessive thirst, excessive urination. Some of the physical signs, you may see a darkening of the skin in the back of the neck. Those may be some warning signs and symptoms that you may be concerned about.
And then another issue that affects children is asthma. It apparently affects 6.1 million kids in the U.S. according to the CDC. That's about 8% of kids in the country 17 and under. So tell us a little bit about asthma and what can we do? How should we be looking out for it as parents?
Well, asthma, you may worsen your lung function when you're wheezing. So when you hear that sound of wheezing in the lungs, that may be a sign symptom that your child has asthma. As a parent, one of the things you should avoid is smoking, especially smoking inside the house. So that's one of the recommendations we give to the parents.
Well, they shouldn't smoke at all. That's the most important thing to remember, is smoking is probably the number one thing that you should not be doing. But if you are, that's good advice to make sure you're not smoking around your children, because even the secondhand smoke can affect their asthma. And then another issue that we see with kids is allergies. We hear a lot about food allergies as well as just allergies to the environment. Can you tell us a little bit about allergies, and is this something that we sort of have to live with? There's really, I've had allergies my entire life. I remember sneezing up a storm as a kid. I'm assuming there's nothing you can really do other than know your triggers and try to avoid them?
Yeah, sometimes allergies, they may require testing, skin testing. If the allergy is severe, that's with an allergist, a specialist in that area. For regular seasonal allergies that may cause some congestion, I think one of the things is using normal saline sprays. If needed, there's like nasal steroids, there's antihistamines, allergy medicines, and of course, if there's food allergies, you should avoid the triggers as well. Some people may even require epinephrine, having an epinephrine pen available in case. Sometimes allergies may even close its throat, the air pipe.
So the famous EpiPen, sometimes you're required to keep that on you. So just making sure when it comes to allergies, they don't sound so serious, but they can be life-threatening if you don't handle them. Alrighty, well, thank you so much for your time today. We really appreciate it. And if you would like to learn more about childhood illness prevention tips, you can visit the South Texas Health System website.
Thank you.